Sunosi, or solriamefetol, is a wake-promoting agent indicated to improve wakefulness in adult patients with excessive daytime sleepiness associated with narcolepsy or obstructive sleep apnea. In preclinical studies, Sunosi demonstrated low-potency dopamine and norepinephrine reuptake inhibition via dopamine and norepinephrine transporters. It is presumed that Sunosi inhibits dopamine and norepinephrine transporters by binding and selectively blocking the reuptake from the synapse. In vitro studies showed Sunosi binds to both dopamine and norepinephrine transporters and has a negligible binding affinity for serotonin transporters. Sunosi blocks the reuptake of dopamine and norepinephrine, but does not show any significant functional activity in blocking reuptake of serotonin. Additionally, Sunosi did not interact with other wake-promoting neurotransmitter systems, including histamine H1 or H3 receptors, did not activate hypocretin receptors, and did not inhibit the stimulatory effects of hypocretin. Sunosi is not an MAOI. No broad enzyme inhibition or activation was observed, including MAOA or MAOB. This targeted dual activity of solriamefetol at dopamine and norepinephrine transporters, along with the lack of significant monoamine-releasing properties, are distinct to Sunosi. Indications and usage. Sunosi is indicated to improve wakefulness in adults with excessive daytime sleepiness, EDS, associated with narcolepsy or obstructive sleep apnea, OSA. Limitations of use. Sunosi is not indicated to treat the underlying obstruction in OSA. Ensure that the underlying airway obstruction is treated, for example with continuous positive airway pressure, CPAP, for at least 1 month prior to initiating Sunosi. Sunosi is not a substitute for these modalities, and the treatment of the underlying airway obstruction should be continued. Important safety information. Contraindications. Sunosi is contraindicated in patients receiving concomitant treatment with monoamine oxidase inhibitors, MAOIs, or within 14 days following discontinuation of an MAOI because of the risk of hypertensive reaction. Warnings and precautions. Blood pressure and heart rate increases. Sunosi increases systolic blood pressure, diastolic blood pressure, and heart rate in a dose-dependent fashion. Epidemiological data show that chronic elevations in blood pressure increase the risk of major adverse cardiovascular events, MACE, including stroke, heart attack, and cardiovascular death. The magnitude of the increase in absolute risk is dependent on the increase in blood pressure and the underlying risk of MACE in the population being treated. Many patients with narcolepsy and OSA have multiple risk factors for MACE, including hypertension, diabetes, hyperlipidemia, and high body mass index, BMI. Assess blood pressure and control hypertension before initiating treatment with Sunosi. Monitor blood pressure regularly during treatment and treat new-onset hypertension and exacerbations of pre-existing hypertension. Exercise caution when treating patients at higher risk of MACE, particularly patients with known cardiovascular and cerebrovascular disease, pre-existing hypertension, and patients with advanced age. Use caution with other drugs that increase blood pressure and heart rate. Periodically reassess the need for continued treatment with Sunosi. If a patient experiences increases in blood pressure or heart rate that cannot be managed with dose reduction of Sunosi or other appropriate medical intervention, consider discontinuation of Sunosi. Patients with moderate or severe renal impairment could be at a higher risk of increases in blood pressure and heart rate because of the prolonged half-life of Sunosi. Psychiatric symptoms. Psychiatric adverse reactions have been observed in clinical trials with Sunosi, including anxiety, insomnia, and irritability. Exercise caution when treating patients with Sunosi who have a history of psychosis or bipolar disorders, as Sunosi has not been evaluated in these patients. Patients with moderate or severe renal impairment may be at a higher risk of psychiatric symptoms because of the prolonged half-life of Sunosi. Observe Sunosi patients for the possible emergence or exacerbation of psychiatric symptoms. Consider dose reduction or discontinuation of Sunosi if psychiatric symptoms develop. Most common adverse reactions. The most common adverse reactions, incidence greater than or equal to 5%, reported more frequently with the use of Sunosi than placebo in either narcolepsy or OSA, were headache, nausea, decreased appetite, anxiety, and insomnia. Dose-dependent adverse reactions. In the 12-week placebo-controlled clinical trials that compared doses of 37.5 milligrams, 75 milligrams, and 150 milligrams per day of Sunosi to placebo, the following adverse reactions were dose-related: headache, nausea, decreased appetite, anxiety, diarrhea, and dry mouth. Drug interactions. Do not administer Sunosi concomitantly with MAOIs or within 14 days after discontinuing MAOI treatment. Concomitant use of MAOIs and noradrenergic drugs may increase the risk of a hypertensive reaction. Potential outcomes include death, stroke, myocardial infarction, aortic dissection, ophthalmological complications, eclampsia, pulmonary edema, and renal failure. Concomitant use of Sunosi with other drugs that increase blood pressure and/or heart rate has not been evaluated, and combinations should be used with caution. Dopaminergic drugs that increase levels of dopamine or that bind directly to dopamine receptors might result in pharmacodynamic interactions with Sunosi. Interactions with dopaminergic drugs have not been evaluated with Sunosi. Use caution when concomitantly administering dopaminergic drugs with Sunosi. Use in specific populations. Renal impairment. Dosage adjustment is not required for patients with mild renal impairment, eGFR 60 to 89 milliliters per minute per 1.73 square meters. Dosage adjustment is recommended for patients with moderate to severe renal impairment, eGFR 15 to 59 milliliters per minute per 1.73 square meters. Sunosi is not recommended for patients with end-stage renal disease, eGFR less than 15 milliliters per minute per 1.73 square meters. Abuse. Sunosi contains solriamefetol, a Schedule IV controlled substance. Carefully evaluate patients for a recent history of drug abuse, especially those with a history of stimulant or alcohol abuse, and follow such patients closely, observing them for signs of misuse or abuse of Sunosi. For example, drug-seeking behavior.